Can incontinence return after bladder sling procedures? Incontinence can indeed return after bladder sling procedures, especially those aimed at treating stress urinary incontinence. This type of incontinence involves leaking urine during activities that put pressure on the bladder, like coughing, laughing, or exercising. While bladder sling procedures, particularly mid-urethral slings, are commonly performed and can be effective, recurrence of incontinence is a possibility that patients should be aware of. The rates of recurrent incontinence can vary significantly. Studies suggest that after undergoing sling surgery, around 2% to 46% of women may experience a return of stress urinary incontinence. The likelihood of recurrence often depends on several factors, including the specific type of sling procedure performed, the individual characteristics of the patient, and whether the sling was revised or removed. For instance, when it comes to sling revision surgeries, which may involve adjustments like loosening or even partial or complete removal of the sling, the rates of recurrent incontinence can be notably high. Some studies indicate that recurrence rates can reach up to 46%, with the highest rates observed after complete or partial excision of the sling, which can be as high as 60% to 67%. In contrast, rates tend to be lower after procedures that simply loosen the sling, with recurrence around 8%. It is also important to note that repeat sling surgeries generally have lower success rates compared to the initial procedures. Women who undergo a second mid-urethral sling procedure are nearly twice as likely to experience failure compared to those having their first sling surgery. However, many patients still report improvements in their symptoms and overall satisfaction with their treatment. Several risk factors may contribute to the return of incontinence after sling procedures. These can include issues with urethral sphincter function, which may be more common in menopausal women due to decreased estrogen levels, as well as factors like a higher body mass index or other individual health considerations. The causes of recurrent incontinence often involve a mix of inadequate support for the urethra and sphincter dysfunction. When dealing with recurrent incontinence, management strategies are tailored to the individual. This may include additional surgical options, behavioral therapies, or medications. There is no one-size-fits-all approach, and decisions are typically based on the patient's specific symptoms, anatomy, and overall health. From the perspective of bladder health, it is crucial to understand that while sling procedures focus on urinary incontinence, they do not address bladder cancer. However, managing incontinence effectively is essential for maintaining bladder health and preventing complications like infections or skin issues. If you have a history of bladder cancer, it is vital to discuss any urinary symptoms or potential surgical options with your healthcare provider to ensure comprehensive care. In conclusion, while bladder sling procedures can be effective for many individuals, there is a possibility that incontinence may return, particularly after revisions or excisions of the sling. Careful selection of patients, surgical techniques, and follow-up care are key to optimizing outcomes and managing any recurrent symptoms effectively.